Welcome, everyone. Thank you for joining today's webinar on navigating difficult vaccine discussions with families. Given the attacks on wellness vaccines in Kansas and the legislature and delays in the approval of the COVID-19 vaccine for children under 5, we think this is an important and timely topic. As you know, childhood vaccination is a sensitive topic, whether discussing wellness vaccines or the COVID-19 vaccine. It's important to meet people where they are with empathy and active listening. This webinar will be recorded and posted at thehealthfund.org. It is part of a short-term campaign being led in Kansas as part of the We Can Do This campaign on behalf of the Health Fund. Some quick housekeeping notes before we get started. Given the large number of folks on this call, your lines are muted. However, we hope you use the chat function to engage throughout the webinar. Please take a moment now to introduce yourself in the chat, and please ask questions in the chat. We're going to hold questions for the presenters until after both presentations are done, but that doesn't mean it should hold you back from listing questions in the chat now. We will be monitoring the chat and plan to take the questions at the conclusion of both presentations. We also, depending on time, may use the raised hand function. However, please use the chat. With that, I just want to take a moment to thank our co-sponsors for this important discussion. We know that parents are facing a number of questions, both with the COVID-19 vaccines and wellness vaccines, given the environment. And we thought this webinar was critically important to help early childhood partners, stakeholders, and providers to be able to navigate those difficult conversations with partners. And I can't say enough about the great early childhood partners that we have in Kansas. From the First 1,000 Days campaign and the Kansas Breastfeeding Coalition, Community Care Network, the Association of FQHCs, Kansas Action for Children, Immunize Kansas Coalition, the Kansas chapter of the American Academy of Pediatrics, the Kansas Head Start Association, the Kansas Parents as Teachers Association, and the Mid-America Immunization Campaign and Nurture KC. So thank you all for your partnership, helping share information about this work, and also all the work you do each day to help ensure kids and families have the healthiest start to life. As we get started, I just wanted to review the agenda. I'll spend a few minutes on welcome and background. Then we're really fortunate to be joined by Dr. Gretchen Homan, who is a pediatrician and the president-elect of the Kansas chapter of the American Academy of Pediatrics. She's also a past chair of the Immunize Kansas Coalition. She's an expert on vaccinations and immunization. So we're excited to have Dr. Homan with us. We're also joined by Erica McGinley, who's a public health nurse and is serving as a consultant for childcare. We're helping childcare centers throughout Kansas be prepared to mitigate the impacts of COVID-19, as well as have difficult conversations about vaccinations and immunization. So we have two great presenters today, and we have over 100 folks registered for the conversation. So we're really excited about the conversation. I wanted to spend a few moments talking about vaccine acceptance in Kansas. I think we can spend a lot of time reading headlines, including just yesterday, about what happened at the State House, seeing questions being raised about whether or not the public supports wellness vaccinations for children, making sure children are vaccinated and immunized before they get to school. I've had these conversations with chambers of commerce, and before I saw some data, and I was admittedly a little tepid in having the discussion with some business leaders. However, we know how important vaccination and immunization are to ensuring children have a healthy start to life and to averting disease, averting emergency room, and even averting death. So the Mid-America Immunize Coalition and Nurture KC had actually done some great polling. I think it's important that we ground ourselves in this polling. Fully 95% of Kansas voters believe wellness vaccines are a good thing, including 77% who say they're a very good thing. More than 9 out of 10 Kansas voters believe that wellness vaccines are completely, mostly safe, including strong majorities of Republicans, Independents, and Democrats. More than 9 out of 10 Kansas voters believe wellness vaccines are completely, mostly effective, including strong majorities across the aisle. And more than 9 in 10 Kansas voters support vaccine requirements for children to attend K through 12 schools. So while there's a lot of headlines and efforts to poke doubt in some of these requirements. I think we need to be grounded in the fact that Kansans understand how important vaccines are to making sure kids are healthy and being ready for school. And I think it's important that we feel confident about that and feel strong as we speak about that. However, at the same time, we know that it's important to meet Kansans where they are and be empathetic and to respond to any questions that they have. As part of the work that we've done at the Health Fund to try to build faith in vaccines, we've created both a faith in vaccine toolkit for congregations and pastors on how to talk about vaccines, both the COVID-19 vaccine and also wellness vaccines. We've also created a toolkit for lay leaders and congregants to talk to their families about vaccines. And this is informed by also message research and conversations that we had across the state, roundtable discussions with our healthy congregation faith leaders over the last year. Some key takeaways as we think about having conversations about the COVID-19 vaccine, and I think the wellness vaccines, is starting from a place of empathy and understanding. We know that these conversations can be difficult, and we need to acknowledge that getting vaccinated is a personal decision. We should state clearly what we do and don't know, and not everybody is an expert. That's why we have Dr. Homan and Erica to join us, and we know there's resources like this in your community, and we shouldn't be afraid to use them. We should draw on those resources. But we should also focus on the benefits of getting the COVID-19 vaccine and getting wellness vaccines. And as we think about conversations about the COVID-19 vaccine, it's really important to explain the health risks associated with declining to be vaccinated. We know that hospitalization, serious illness are a result of not being vaccinated. And we also know that the best way to protect kids and immunocompromised people is for higher rates of vaccination in the community to reduce community spread. After talking, let them know that you're opening to continuing the conversation and encourage them to take at least one step to exploring what it means to be vaccinated. So I think just again, sort of to underscore, meeting people with empathy, starting the discussion, trying to keep the conversation going, and encouraging them to take further inquiry. And this really is a point in this conversation where it's not too late to have this conversation. There's still time to talk to folks about being vaccinated, and then really continue the conversation about folks getting boosted. But you build a house brick by brick, so just one step at a time. I think it's important to be direct and also let folks know that a vaccine is reserved for them. We have this toolkit on our website, 15 things you can do to improve vaccine acceptance. And it's in your congregation, but it's actually, I think it extends to your family. One is lead by example, get vaccinated, encourage your staff to be vaccinated. And then another opportunity is to find ways to help support folks getting vaccinated, make it as easy as possible, offer transportation for those who are homebound to get vaccinated. So there's some really concrete things that we want to suggest that we can help aid this process to make it as easy as possible. With that, I want to turn things over to Dr. Homan. Dr. Homan is an associate professor at the KU School of Medicine in Wichita. She's president-elect for the Kansas chapter of the American Academy of Pediatrics, former chair of the Immunize Kansas Coalition, and has got her medical degree from the University of Kansas and her undergraduate degree from Wichita State University. We're very fortunate to have Dr. Homan join us, and I hope you take advantage of her expertise in the chat and ask any questions that you may have. Dr. Homan, I'll turn things over to you.
Thank you so much. I'm so happy to be here today and to talk with all of you guys about the importance of immunization and how to engage others in these conversations. I think I'm ready for the next slide. Thank you. So, protecting Kansas with immunization, and this is really important because this is the whole, start with why we are doing this, because we care about each other and we want a healthy Kansas. And we can do that by helping to spread the information that is most helpful for children to be vaccinated, as well as the communities that they live in. Next slide. So we really need a culture of immunization throughout multiple different areas. one of the goals here today is for me to help you feel confident and comfortable making a recommendation and sharing your experience, specifically with getting COVID vaccine, and sharing that not only where you're working, but also in the communities where you live. We know people don't necessarily make health decisions based on statistics or on data, but rather sometimes they decide based on a feeling or what they think is best for them, given their situation and where they live and what's going on in their lives. So it's a collection of things that they look at in terms of signals and images, and they put that together within their mind and come to a decision that's best for them. So we want to help them to make a good decision. And we know that healthcare professionals are a trusted source of information about vaccines. And we also know that not everybody has a primary care physician, and there are barriers throughout the state as far as accessing healthcare. But if there are things that you can do within your community to try and reduce some of those barriers, that's a good first step. Encourage people to call their doctor's offices, make appointments, and ask questions. Parents' confidence is also increased in vaccination when they hear the same information from different people. So part of what we're doing today is sharing this information with you all so that within your circles of influence, you can share the information. And then when they make those appointments and talk to their providers, they hear the same messaging. Inconsistent messaging is very confusing, and we've seen it with the pandemic for sure. So that's something that makes it hard, and we're trying to make that better for people. Let's see. Let's go to the next slide. All right. So a couple of the questions that we hear often from families are around safety. And rightfully so, parents want to make the best decision for their children. And I really believe that nothing's more important than our kids. And I say that as a parent and also as a pediatrician. We really feel that it's a huge responsibility to make healthcare decisions for your kids. So we have to know that vaccines are safe when we're making that choice for our kids. So how do we know that a vaccine is safe? Let's go to the next slide. Thank you. So this is a very busy slide, but I did want to share it with you in terms of some background for how vaccines are developed. And this is a process that here in the United States, we've been engaged in for many, many decades. So way prior to the COVID pandemic, vaccines are put through different phases of development. And what we did see with COVID was that the phases were accelerated because we had support to kind of run things simultaneously instead of in sequence. But traditionally, there is a longer time between phases. And the first thing that they look at when developing a vaccine is safety. And when you think about it, vaccines are very different than other medicines or interventions that we do in healthcare because they're given to a healthy population. So it is quite different to think about somebody who is sick or maybe in the hospital or dealing with a chronic illness and has that as their baseline. So when they're taking a medication or deciding on an intervention, they're at a different baseline for their health. When we are giving vaccines, we're looking at a healthy population. So safety is paramount. And that's exactly what we achieve through this process of multiple phases and studying of new vaccines as they're developed. Phase one involves a small number of people that are enrolled in the clinical trials. And as they test safety, they expand and move on to phase two with more people. And as you can see in phase three, the population that is studied grows tremendously. And when we think about children and vaccines, sometimes as we see with the COVID vaccine too, children are not often in the first populations that are studied. So what happens is vaccines that are designed specifically for them tend to come out later. So, that's what we're seeing right now because our youngest children right now still have not had the opportunity to get a COVID vaccine. And I know that's on a lot of people's minds as it should be. So And that's partially by design for how we study safety. There are multiple organizations involved, including the CDC and the FDA. And let's go to the next slide. Okay. The other thing that's important to remember too, in terms of background, is that some of the technology and scientific advancements that we utilize when developing vaccines, that scientific work has been done years before the process of even designing a vaccine begins. So when we look at, for example, the mRNA technology, that was in development 10 years before COVID. And then when we had the opportunity to utilize that for the COVID vaccine, it was ready for us to do so. And it's possible that today, right now, there are scientists who are developing things that we don't know about. And in 10 years, when we learn about them, it'll feel very new to us, but it's really something that's been studied for quite a while. Once a vaccine has been put through that process for safety, and I kind of skipped over some of the details because it's a very, very complicated process, but safety is the first thing that is looked at, and then closely followed up by efficacy. So they want to make sure it works, because otherwise there's really no reason to do that. Once they've figured out those two main things, and we've seen the ACIP, which is an organization that works with the FDA and the CDC and makes recommendations for how to authorize vaccines in our country. Once all of those decisions and expert groups are confident in the vaccine, and it's released to the population and given to people outside of clinical trials, the vaccine continues to be monitored for safety and efficacy. So this kind of shows you some of the main monitoring systems that we use for safety. I think the VAERS system, which is listed on top, Vaccine Adverse Event Reporting System, is probably the most widely known system for monitoring safety. And perhaps, though, it is the most misunderstood system. So VAERS, I did want to spend a few minutes talking about, is a system that anybody can report to. I, as a physician, can report to VAERS if I encounter what I consider to be an adverse effect from a vaccine, and any vaccine. And so can a family or an acquaintance of a person, anybody can report to VAERS. And the purpose of VAERS is really to function as an early warning system to detect safety signals. So that's what it's designed to do. But what it cannot do is explain causality or the reason why something happened. And I think it's hard for people sometimes to look at the information that's in VAERS and make that understanding when they're shown so much data coming in about vaccines. The other two systems that are listed there, well, kind of three, the VSD and PRISM and the CISA project, those are available for healthcare professionals to kind of coordinate together and ask questions about specific patients and get more expertise as far as specific patients and vaccines, and making clinical decisions for each individual patient if that's what's needed to do. But it's important to know that all these systems work together and are monitored for the purpose of safety and keeping our vaccines safe for our population. And we're talking about every vaccine. So if you think about, we do have a lot of vaccines, which is a good thing. And there was a new system that was created to monitor for COVID vaccine safety as well that I didn't even mention today, but this monitoring is extensive and ongoing. So I just wanted to make sure everybody kind of had a picture about that. Let's go to the next slide. So yes, what's the question? Do kids need the COVID-19 shot? Yes, kids need the COVID-19 shot. And, I'll share with you that as a parent of two boys, they both got their vaccines as soon as they were age eligible, and it went well. And, we were so relieved that they could have that, and it helped with so many things. And, I just started listing things, why do kids need vaccines? Well, there's so many reasons, because they're in school. They want to be with their friends. They want to see their family. They want to have fun and travel and do their sports and activities. And thinking back to when the pandemic first began and schools were closed, I just, could never fathom that would be something that my kids and family would go through. And it was so hard. And I don't want to ever do that again. So if we can vaccinate and prevent infectious disease spread, that's definitely what we want to do. Kids really need they need their lives. They need to stay engaged and keep being kids. And so because we love kids and we want them to be happy and healthy and strong and do all their kid things, that's why they need the vaccine. Okay, let's go to the next slide. So right now we have a COVID vaccine that is available for children age 5 and up. And then so it's broken down into 2 different doses. So age 5 through 11 gets a smaller dose, and then 12 and up really gets the adult dose. And children can receive the COVID vaccine with other vaccines on the same day. So if they're going in for a regular appointment and they have wellness vaccines that are also due, that works perfectly fine. They can do all of them together. And then it is the 2-dose series about a month apart. And I think the spacing between the doses is something that families can talk to their provider about as well. But it is 2 doses at this point. And then the conversation about boosters, depending on the situation. So it is a lot to take in and figure out, and really encourage people to talk to their specific providers about what they have available. And things are changing. COVID's been, it's been challenging to keep everybody up to date as far as specifically with guidance and with vaccines. And it looks like, we'll have some new options coming up available soon, but within your local area, you want to find out what vaccine they have available, and then specifically what ages it's for. And coming up, we do expect to be able to start vaccinating those youngest kids starting at age 6 months through 4 years. And that'll be something that we expect will take place more in primary care settings and not so much in like mass vaccination clinics or in pharmacies. And that's going to be really important that families are able to access that through their primary care providers. Since those youngest kids and even below 6 months, they will not be eligible. It's really important that we vaccinate those around our children. And that includes and starts with pregnant moms. So we know that the science has shown that when pregnant moms get vaccinated for COVID, it does protect their babies. And we definitely want to encourage that and support them. And it's also helpful overall for moms to breastfeed as well if they can do that. And kids who are around adults who are vaccinated are then kind of in a bubble of protection as much as they can be until they're eligible to get their own vaccine. So something to think about how we can help everybody, especially when not all of the tools are currently available to our youngest kids. Let's go to the next slide. Thank you. So we talked a lot about safety, and it's super important, like I said, because we give vaccines to healthy people. And then the second question right after that is, do they work? And so I want to spend a little bit of time talking about that. And let's go to the next slide. Thank you. This is a graph that I really like to share about hepatitis B. And it goes way back to the 1980s when the vaccine for hepatitis B was first kind of made available. And initially, the vaccine came out, and there was a little bit of a delay between its release and the time that it became widely accepted within, the population. And so this line shows new hepatitis B infections. And so we did see where that arrow points is the time when we first had the vaccine available, and infections continued to rise because the vaccine wasn't widely being utilized. But once it was, oh my goodness, the line just plummets, and it's so wonderful to see that. And we give routinely, we give hepatitis B vaccine to newborns, and that's the only vaccine we give right after a baby's born. And when we started doing that, the results were very dramatic, that hepatitis B infections declined. And I mean, so do they work? This shows the hepatitis B vaccine in graph form, answering that question, yes. Let's go to the next slide. And so the CDC also keeps an eye on effectiveness, and they have multiple monitoring systems, and it's actually fairly complicated. They study things based on age groups and environments, and there is some information available on their website if you want to take a look at that. But and this is specifically for COVID-19. There is a tremendous amount of monitoring and data available online. So that's something to look at if you guys are interested. The FDA also requires a very high level of effectiveness for vaccines before they will go ahead and authorize them. So like we talked about before, that's some of the information that they look at when they are doing those early clinical trials. So a vaccine won't come out of the clinical trials for public use unless it is determined to be effective. We know, with COVID, it's been challenging because of the different variants. And so this is something specifically that they're keeping an eye on as well. And so far, what we know is that the vaccines are very, very effective at preventing serious disease and definitely reducing risk of hospitalization and death. And I think it's important to remember that no vaccine is 100% effective. And so that's why it's important that we have as many people vaccinated as we can, because that really reduces the potential of any one of us coming in contact with the infection. The other thing to keep in mind is that we are still recovering our hospital workforce. And within those hospital systems, even right now, it's very difficult. And so if there are things that we can do to keep ourselves healthy and to stay home and not have to require hospitalization, that's something that would be very important to consider. Let's go to the next slide. Thank you. And so these are some of the common questions that we get about COVID-19 and children. And I think it's important to stop and ask, and be a listener, and then and see if there are specific questions that the people you're talking to have about the vaccine. And like I said, some of the most common questions are: is it safe? And is it needed? Is it necessary? So we know that it's safe because it's been studied, and it's actually already been given to quite a lot of children in the United States. And like I said, both of my kids had it and did fine. The other thing I want to explain and make sure people understand is the difference between the way the vaccine works and an adverse event. And so it may be the situation that you have a fever or a sore arm, or feel fatigued, or maybe you don't just feel okay for a day or so after you get a vaccine. And all of those indicators are really your body telling you that your immune system is responding to the vaccine and it's getting to work. So it's recognizing that it was given this kind of recipe to attack the infection. And so it's preparing and it's taking steps to be ready in case you do encounter the COVID infection. And really that's how the vaccine works. And so it may be that you are someone who feels some of those side effects after getting vaccinated, but those are really not considered adverse events. That's just kind of the normal process of the immune system responding. So I think it's important to think about that. And that may be, one of the questions that families have when they're trying to plan for their vaccines, if you want to do it on a Friday or a spring break, or, maybe the summer is a good time. And speaking of the summer, it is not too late to vaccinate for COVID. I would highly recommend that if, you're talking to somebody who's not yet vaccinated, go ahead and encourage them to do that. This is the time to do it. In fact, this is what we really do with all other wellness vaccines. We give them when we are not having disease outbreaks. And that's exactly how we know they work. we're not having measles outbreak or polio right now. And that's because our population is highly vaccinated and protected against those things. And we keep vaccinating kids for those things every day. And that's, I don't know for sure how the COVID vaccine will be incorporated in the long term, but for right now, it is still recommended to get vaccinated against it. And, it's a good thing, that third bullet point there, that most children do not get very sick with COVID, but some get very sick. And we really do not have a way to tell which kids that's going to be. And so the best thing to do is to prevent them from getting COVID if you can by getting vaccinated. And really, when you think about children, and you don't know if, if I could tell you it's 1 in 500 kids, just pulling a number out of the hat, it really, if it's your kid, that's all that matters. And so that's how we talk to families. And that's how I think of it for myself and my own family, is making that best decision for that one child, because that's the one that we're talking about. That's the one that matters. And yes, if your child has already had COVID-19, we still recommend getting vaccinated. The immune system is amazing and it works in many different ways. And we know that giving the vaccine can help with certain types of immune preparedness. And so, yes, it's still recommended to go ahead and get vaccinated if you've already had COVID. Let's go to the next slide. Okay. So having conversations about vaccines can be tricky. And one of the things I wanted to make sure that you all kind of take away from today is to remember why we feel so passionate about it. It's because we care about the people. So I encourage you to kind of take a breath whenever you feel like you're starting a conversation on a topic that maybe is emotional, and think about taking care to preserve the relationship with that person, because that's who you care about. You care about the person, and that's why you really want to encourage them to get vaccinated, because you don't want anything bad to happen to them. You don't want them to get sick. So it's really about the person. And if you need to, step back and do more listening, I would encourage you to take that approach and do what you can to preserve that relationship, even when talking about vaccines. So let's go to the next slide. We try to welcome questions from parents. And really, it's great that parents have questions and that they're engaged, because like we talked about before, it's such a huge responsibility to be a parent and to make healthcare decisions for your children. So it would make sense that they should have questions. And a lot of times they're, about safety or necessity. And we want to just hear them and give them time to explain, what they've heard or what their concerns are. And we know this can be an emotional decision for some families. So trying to stay calm again and preserve that relationship is super important. And if you're unsure or you don't know an answer to a question, that's perfectly okay. And like we talked about, especially with COVID, there are a lot of changes and lots of different things to keep up with. So try and refer to somebody who you think might be able to answer a specific question. And then I like this kind of motivational interviewing idea, which basically involves listening to the person and then doing some reflection on what you've heard and try to uncover maybe their main concern, and then ask them if it's okay. Is it okay if I talk to you about what I think or what I've experienced? And then make sure they understand it's up to them. This is their decision and you're here to support them, and make sure they have all the right information, but it's their decision. Let's go to the next slide. So once they want to get vaccinated, it's important that we have access to vaccines. And we have different opportunities depending on what community you're in and what the resources are. So definitely primary care providers, but also health departments, and sometimes pharmacies are a good option, maybe for the older kids. But there are some clinics across the state that don't always stock pediatric vaccines. and who may not also stock COVID vaccines. So that does create a barrier and make it a little bit more difficult for families to get vaccinated. And, I was thinking earlier when we talked about helping people get transportation and going to appointments, if you have a group that you can get together and we can bring the vaccines to them, that may also be an opportunity. So try to problem solve, where you are and what resources we can bring to help keep people access this. It's so important. So we don't want people to not have it just because it's hard to find. That said, we do want to reduce any barriers that we can. So have those conversations, because if a family thinks that you are not recommending it or engaging in that conversation, they may actually take that as a negative or anti-recommendation. So I think that's really important too. This is something that's kind of on everybody's mind, whether we actually talk about it out loud or not. So if you're in a situation where it's appropriate to make a recommendation, please go ahead and do so. Okay, next slide. So some of my key points here for all of the providers out there, use all of the tools that you have within your systems to find people who might be due for vaccines, and try and have that culture surrounding, everybody that they encounter within your system of pro-vaccination. Everybody recommending the same thing, using the same language that's supportive, and partner with local supporters who can kind of extend your reach if you're not able to, see everybody within the community. Also know that the COVID shot is safe and it's important for kids, and it's not too late. And it takes all of us. It really takes all of us to help immunize our children and the adults in our state so that we all can be healthy. And I think that might be my last slide.
Excellent. Thank you so much, Dr. Homan. You really did a good job, I think, helping provide the great detail behind the fact that the vaccine's safe, that there's a quality control program behind it, that there's a reason to do this, and that you're leading by example. So I really appreciate you, and then how to talk with folks using motivational interviewing. So thank you for all of that information. I know it would make me feel more confident about having conversations with parents, and then also knowing that pediatricians like you are available as resources for early childhood providers to have these conversations. And we're also fortunate to be joined by Erica McGinley, who is a consultant with the Child Healthcare Consultant Network at Child Careware. Erica is also a public health nurse and has a great deal of experience talking to families about immunization and the COVID-19 vaccine. So I'll turn things over to Erica now. And again, if you had questions for Dr. Homan or for Erica, please put them in the chat, and I'll turn things over to Erica now.
Thank you so much. Thank you for joining us for this important conversation on vaccine hesitancy in families. I have had the opportunity to work as a public health nurse and received my nursing degree from Missouri Western State University, which is in my hometown of St. Joseph, Missouri. And then I have a master's in public health from Kansas State University. And the experience that I have in the field comes from a combination of public health time, as well as serving as a child and youth services nurse on a military installation. And in both of those roles, I had the opportunity to work with children ages 6 weeks to 18 years with a variety of special needs. And when I worked as the child and youth services nurse, I did teach our daycare providers medication administration, communicable disease, bloodborne pathogens, as well as diabetes and first aid and CPR. And one thing I did have the opportunity to do in both roles was go into those daycare facilities and provide education hands-on to those daycare providers. And also in a clinic setting, when families would apply for vaccine waivers, they actually came through our clinic, and we provided education one-on-one to those families about the routine childhood immunization schedule and the purpose of that. So I had a lot of really good conversations on this topic. And just like Dr. Homan led with, what's the reason behind vaccinating? Children are exposed to thousands of germs every day in their environment. So these vaccines serve to strengthen their immune systems. Vaccines use a small amount of antigen, which is defined as a part of a germ, to help the child's body recognize certain diseases and then learn how to fight them. So vaccines are providing that immunity before children are exposed to diseases that could be potentially fatal or life-altering. And I have a short video here that I just wanted to share with you all, and then a few points from it that I'd like to highlight.
All right, buddy, let's check you out and see.
Hey, Daddy, how you doing, huh?
Parents are very worried. I mean, we're getting a lot of phone calls asking about immunization status and also whether their children should get the MMR early.
And we do have some friends who live further north that are very anti-vaccine. This was, when I was pregnant with him, and oh my, he's never sick because we didn't do the vaccines. We recommend you not doing them.
I'm convinced that most people make this decision not based on fact, but on feeling. Oh, I don't think I feel like I want to get my child immunized because of what I've heard from friends or what I read on the internet. There was a study in 1998 by a Dr. Wakefield which showed a possible association between the MMR and autism in a small number of children. Subsequently, that study has been shown to be inaccurate because a lot of the evidence was falsified, and in fact, Dr. Wakefield lost his medical license. Facts are that many studies have been done to look at the safety of vaccines, and they're looking at large populations of children, and it's been determined that there is no association between the two, so that autism is not caused by the MMR. The CDC and the National Institute of Health have conducted a number of large studies, both looking at the effects of thimerosal, which is mercury, and that's another concern that parents have, that mercury-containing vaccines might have a negative effect. We effectively have removed mercury or thimerosal from all the children's vaccines, and we've not seen any drop in autism or any other positive effects from that. So that clearly autism is not caused by the thimerosal. Some parents voice the concern that there are so many vaccines, and do we really need all of them? There's no evidence that there's a problem with that. The children's immune systems are well suited to be able to tolerate all that. And the current recommendation for the measles vaccine is that they get their first shot at a year of age, and then they get a second shot between 4 and 6 years of age. You're protecting your children, and you're also being a good citizen and getting your child immunized.
He's all set. We're of the mindset to listen to the doctor and do what he says. Feel confident.
Do knuckles?
Knuckles? Cool.
All right.
I like it.
All right, and so a couple of things I wanted to highlight from that is the study that was done by Dr. Andrew Wakefield. The article that he wrote was retracted from the medical journal in which it was published, and he did lose his medical license. Within his research, he used a really small sample size, and so when you do that, it's typically you're not able to extrapolate that information and just apply it to the whole population. And unfortunately, even though, as you saw, it was determined to be inaccurate, the thought behind that kind of lingered in the community, and ever since then has really created a lot of doubt and additional vaccine hesitancy. The pediatrician also mentioned that by getting vaccinated, these kiddos and their families are being good citizens. And it's exactly as Dr. Homan described. Those who are eligible candidates for vaccines that receive them are essentially protecting the rest of the community members who are either too young to receive those vaccinations or for medical reasons are unable. So when we are fully vaccinated, we form that bubble or that layer of protection around those, who are next to us, beside us in our households. And then the last thing is something just echoing again what Dr. Homan spoke to about fact versus feeling. And I will say in a lot of the conversations that I had over vaccines and that hesitancy, it did, come across that those families were basing that in a feeling, which again, I as a parent can completely empathize with and understand, because from the time our children are born, we are trying to make the best decision for what to feed them, how to diaper them, what safe sleep environment looks like. It comes with such a huge responsibility. So moving forward and talking about then what is required in the daycare setting to address vaccination per Kansas administration regulations, you do have to have a copy of those kiddos' current immunization records on file. The KAR 28-1-20 defines that immunizations are required for children attending childcare and early childhood programs licensed by the Kansas Department of Health and Environment, or KDHE. And KDHE does, of course, follow the guidance put forth by the Advisory Committee on Immunization Practices, or ACIP, and that aligns with what CDC recommends as well. And of course, best disease prevention is achieved by following the recommended schedule, but if a kiddo gets off that schedule, a catch-up schedule can then be implemented. So in childcare programs, the current immunization record, which the form is linked here, should be on file. And the legal alternatives to that would be a religious exemption, so a written statement from that parent or guardian, or a medical exemption, so this Form B, and it does have to be signed by a licensed healthcare provider. How do we implement that into daycare policy? Well, Caring for Our Children, which is a national database of best practice standards, states that childcare facilities should require that all parents and guardians of children enrolled provide written documentation of received immunizations. And you can see of note on there as well is that legal requirements for age-appropriate immunizations are in place for almost all states. And so the link will take you to a map where you can navigate to see what the different requirements are within each of those states in our country. What's the rationale behind it? Why do we have to have a policy in our daycare programs? Well, if you think about particularly the preschool aged population, those kiddos have the highest age-specific incidence and or are at the highest risk of complications from vaccine preventable diseases. And again, as Dr. Homan mentioned, we don't know in which instance a child will completely recover from a vaccine preventable disease, and in which instance it will, change their life for forever or potentially result in a fatality. Early education and childcare centers have children interacting close to one another. So we haven't quite mastered the art of personal space yet when we're talking about, preschool age and below. And they also have limited ability to perform proper cough and sneeze etiquette and hand hygiene. They're learning those skills, we're teaching those, but not quite as competent as an adult would be with those particular topics. So they're a vulnerable population, maybe not at the age where they've received their full immunization schedule. And then we've got the close interpersonal contact, and they're sharing objects and sharing toys. And this is a picture of that routine immunization schedule. It's updated on the CDC website annually. So if you're needing a copy of that, there's a lot of helpful tools within this packet to navigate that routine childhood immunization schedule. These are questions that I am by no means saying as a childcare provider, you are required to be answering. They're just common questions that come up, and there's a resource linked here to provide answers to some of these common questions. You as a childcare provider are a pillar in your community, and oftentimes parents lean on you as a resource because you are the subject matter expert in early childhood education. So they may ask you these types of things. If you want a resource to have to be able to provide them a handout, this one linked below has all of the answers to these questions within it. So how do you support families? What specifically could you say to them? Definitely encourage parents to ask their questions at those well child checks. And a great method to make sure that they remember and get all their questions answered is to write those down in a notebook leading up to those appointments. It can be really helpful because sometimes the appointments are quick and you might forget something that you really want to ask, but reminding them to use that method can help get those answered completely. Have a clear policy or language in your handbook for immunization requirements for your program. So it's spelled out what that expectation is. And then know where forms related to vaccines are located. So again, the immunization requirements for KDHE are linked here. You can also provide resources to parents, such as the CDC immunization schedule, if requested. And that was pictured in the previous slide. And children ages 5 to 11 are eligible for that Pfizer COVID vaccine. They're currently assessing the safety and efficacy of that vaccine for children younger than age 5. Most common side effects are sore arm, tiredness, headache, muscle pain, nausea, and fever. But the vaccine does prevent potential long-term and short-term complications of COVID-19 infection. And as Dr. Homan mentioned, it's a 2-dose series, typically spaced about 3 weeks apart. And when someone experiences those common side effects, it is their body mounting a response to that vaccine. Those are all within the normal range of reactions. And for a kiddo, if they're experiencing those side effects, a non-aspirin pain reliever can help reduce those symptoms. And why would we want children to be vaccinated? Because we do want them to get out and be kids and to be engaged in sports and in community. And this offers a way to be able to safely do that. So lastly, I just wanted to talk about my personal experience. These are my kiddos. They are age eligible for COVID vaccination. And one word that I can think of when the pandemic started for me as a parent was helpless. I felt helpless. And I was very scared for my children and for myself because it was not an option for them to stay out of childcare. I had to work. I couldn't stay home. We were engaged in some things where we were exposed to the community. And so when I became eligible, I think the word was relief. You know, I thought, well, wonderful, I can have some protection. So at minimum, I hopefully won't get very sick or won't transmit it to my children. But I was definitely scared as their primary caregiver. You know, if I were to come down with COVID, there's really not a way for me to totally isolate myself within my house. So it was a stressful time. And when my kiddos became age eligible, we talked a whole lot about it, and they'd had their flu vaccines from that season. So we discussed, you know, it's going to be a similar process. We'll go into the pharmacy and you guys will get your shots and remember what it was like to get the flu shot. And so the boys are like, yes, okay. And then we'll go get ice cream. So we go into the pharmacy and my oldest goes first. And I'm thinking, okay, great. He's prepared. He'll set the example. And then I look around and I can't find Arlo. And I cannot find Arlo because he has wedged himself in between some chairs in the wall and he is hiding. And, you know, as a parent, you're torn. You always want to make the best decision for your kiddos. And so I'm like waiting, I'm getting sweaty, waiting for this angry mob to like descend upon me, you know, yanking my kid out from under a chair at the pharmacy. And so I finally get him out and then he sits down, but he's like bucking and just fighting the whole process. And the pharmacist is like, I cannot safely administer this. And I said, I totally understand. And so for whatever reason, Arlo sat still for a brief second and got his shot and he stood up and he goes, well, that wasn't so bad. And I'm thinking, not so bad for you. But you know, I was nervous, but I was also really happy and excited for us as a family that this was something that we could engage in together. And that, you know, we are all fully vaccinated, and it gives me a sense of peace of mind. And let's see, there's our contact information. If you want to get in touch with CCHC, you can certainly email us or call us. And again, we just appreciate your time and your listening ears so much. So thank you.
Thank you so much, Erica, and for the information and sharing the story. I mean, I think it's great to hear from both Dr. Homan and from you about how you were anxious and willing to lead, and your kids were too in terms of being vaccinated. You know, I can say also as a parent of two kids who were both just under 5, you know, we made the personal decision as a family to enroll our kids in the Pfizer um, trial because it was important for us to, one, to try to get back to normal and protect our kids as much as possible when they're in a child care setting, as well as to make sure that they were, we were doing what we could as a family to help all of us return to normal. So I think it was really important, and the process has been very safe, and like they have been for the kids over 5. So you know, I can't say enough about the safety and efficacy of vaccines, and we know these conversations are going to be really important as the data is released from these studies, and for the 6-month-old, the 5-year-old vaccines we expect in early June. And if we can be helpful as an organization to share information with this group and others, we're happy to do that. We're running up against time, but I did want to ask one question, and then we have some, if folks have other questions they want answered, we can try to work with Erica and Dr. Homan to maybe answer some questions in another way. One question is just, research has shown that the vaccination against COVID-19 is one of the best ways to reduce the spread and help protect unvaccinated. With that in mind, can you talk about what can be done by child care providers and parents to boost vaccination rates for those eligible, while we have the under 5 cohort and immunocompromised that may not be able to get the shot?
Yeah, and I think it's important, especially now, because early on in the pandemic, we kind of had a Swiss cheese approach to keeping people safe. And we think about the layers we did with masking and distancing and all those different things. And now a lot of those mitigation techniques are done. We're not utilizing them anymore. So really, one of the primary tools that we have still in our toolbox is the vaccine. And so for me, the importance of making sure people get vaccinated is actually elevated, especially now.
Thank you, Dr. Homan. We are right at 1 o'clock. So thank you both, Dr. Homan and Erica, for the presentation, and also for Child Care Aware for partnering with us on this, and the many other co-sponsors. If folks have additional questions, please email them to me at david@healthfund.org. We're going to post this on our website, send out an email, and we know there'll be future conversations about this important topic, about helping families navigate conversations about vaccines, both wellness vaccines and the COVID-19 vaccination. So thank you all for joining us, and let us know how we can be a resource. And thank you to our presenters and co-sponsors. Have a great day.